Welcome to Jumpstart Justice, where in 15 minutes we'll introduce you to important issues and take action together. I'm Noelle D'Amico, Director of Social Justice at the Workers' Circle. Thanks for being with us. Following the program, we'll send you an email with resources to delve deeper. If you're viewing a recording of our live program, just fill out the Count Me In form, and you'll also receive the information. Before we get started, do make sure you have your phone handy. And now I'm so pleased to introduce to you Sammy Moschenberg, a public policy consultant for the Workers' Circle with more than 30 years in the field. Sammy will acquaint us with the public charge rule, how it threatens immigrant rights and public health, and how we can take action. Welcome, Sammy.
Thank you, Noelle. Emma Lazarus's famous sonnet at the base of the Statue of Liberty says, "Give me your tired, your poor, your huddled masses yearning to breathe free." A lovely and inspiring sentiment, to be sure. But for more than 100 years, US immigration law has had a public charge provision that made it clear that we really don't want anyone who is tired or poor. Anyone who would be considered a public charge, primarily dependent on the government for assistance. The language of the public charge law is very vague. That has made it a convenient hook for discrimination against any group deemed to be undesirable. And it has always applied not only to those seeking to enter the US, but to those immigrants here trying to achieve permanent status. Essentially, it is and has been a racist wealth test. In the 19th century, it applied to the disabled, who were all, after all, not the immigrants who could help build America's cities. And in the 1930s, it was used to bar Jewish refugees fleeing the Nazis who couldn't take their assets out of Europe. It has kept LGBTQ immigrants out along with others. In 2018, the Trump administration published a regulation that applied to those seeking to enter the US, as well as to those seeking to obtain a green card. Trump's rule made anyone who accessed a broad list of government programs, including Medicaid and food stamps, a public charge. Despite exceptions, the damage, so to speak, was done. The rule, which took effect in February, just before the pandemic hit the US, had an immediate chilling effect on immigrants across the board, whether they were covered by the rule or not. Here are the words of Teresita Batayola, who's director of the Seattle-based International Community Health Services. Individuals and families started to get scared to access care, even when public charge didn't affect them, because they knew someone or someone else could be affected by it. All these things started to blow up in our faces in the sense that when COVID-19 happened, the impact was worse and our visits started to really go down. Similar reports came in from health centers all over the country, coupled with reports of immigrants avoiding emergency food programs, including those run by the local area or the state, and food programs distributed by schools. Immigrants, whether affected by public charge or not, were staying away out of fear. Add to this the fact that immigrants are on the front lines, working in hospitals, picking, packing, and preparing our food, cleaning public spaces, and so on. It's no wonder that along with people of color, the incidence of COVID and deaths from COVID among immigrants is disproportionately high. Now today, the Senate took a procedural vote on a COVID relief bill that did not include immigrants or that didn't suspend the public charge rule during this pandemic. It's not clear whether they're going to continue to work on a COVID relief bill, but they need to. We must do everything to make sure that there is relief provided as soon as possible. And we must do everything we can to make sure it includes a nationwide suspension of the public charge rule until the end of the pandemic, because we have to dispel the fear that keeps people in harm's way. A threat to some of us is a threat to all of us. Your activism today is critical.
Sammy, thank you so much. It's a difficult update to hear. Can you tell us, though, I understand that the U.S. Citizenship and Immigration Services had actually suspended public charge for COVID-19 testing in healthcare. Why would we need a Senate bill to do this too? Why would it make a difference?
It would make a difference because, first of all, we're talking about things well beyond testing and treatment for COVID. We're talking about food programs. We're talking about all kinds of relief programs. And in addition, immigrants have been so frightened by the sweeping nature of the public charge rule that they don't trust, if they even know about the United States Citizenship and Immigration Service ruling, they don't trust it, and they're staying away out of fear. We need to make sure that it is suspended once and for all during this pandemic.
Thank you, Sammy. Okay, now that we've learned about the importance of suspending public charge, it's time to take action together by calling our senators. This slide will take you through the steps. First, you'll call the Capitol switchboard and say, "Hello, I'm calling from," name of your state, "and would like to speak with my senators." The operator will give you the names of both senators and ask with whom you would like to speak first. Choose one and you'll be connected. Many offices have answering machines right now because of COVID-19, but don't hang up. Leave your message using guidance from the script on the screen. Don't forget to say your name and the city and state in which you live. Then once you complete your call, please let us know who you contacted by typing the name of the senator and the state into the chat line. If there's time, then place a second call to the other senator. Else be sure and call them later. We'll have music playing during the time when we're placing phone calls, and then gather back together to close our program. All right, let's get calling.
Senator Kane's office, please.
people calling in with their reports. We have reached Senator Kane's office in Virginia. We have reached Senator, I'm seeing a couple of here. We've reached Senator Schumer. We have reached Senator Gillibrand's office. I invite you to continue to put the offices that you've reached in the call. That's wonderful. I want to thank you for your advocacy. Following this session of Jumpstart Justice, you'll receive an email with additional resources on public charge, the slides, and advocacy opportunities with the Workers' Circle. Next week, Jumpstart Justice will zero in on combating voter suppression. The stakes couldn't be higher. I hope that you'll join us next Thursday from 2 to 2:15 Eastern Time and spread the word about Jumpstart Justice.